Episode 3: The Forgotten Workhorse. Viewing Ribavirin's role in past viral outbreaks in new light. Welcome back to Ribavirin Reminiscence and Lingering Load in Long COVID-19, where we excavate the genomic archives of antiviral history. I'm your host Anushka with a master's in genomics and passion for sequencing the stories behind medical breakthroughs. Today we are dusting off Ribavirin, a workhorse that fought in the shadows of viral outbreaks long before the spotlight fell on newer antivirals. Could this veteran hold a key to long COVID's enigma? Joining me is Saakshi, a master's student in microbiology whose expertise in microbial battles shine like a perfectly stained slide under a microscope. Welcome, Saakshi.
Thanks for having me, Anushka. I'm eager to revisit ribavirin's unsung heroics and explore its potential comeback in long COVID.
Let's map the terrain like charting a complex genome. Long COVID remains a puzzle. What defines it and why is it so elusive to pin down?
Long COVID, or post-acute sequel of SARS-CoV-2 infection, or PASC, is a heterogeneous syndrome marked by symptoms persisting beyond 4 weeks post-COVID-19, often stretching months or years. These range from debilitating fatigue, cognitive fog, dyspnea, to dysautonomia or even chest pain. Its complexity stems from multiple drivers like immune dysregulation with elevated IL-6 and autoantibodies in 20 to 30% of cases, microclotting linked to D-dimer spikes, mitochondrial dysfunction, reducing ATP production, and viral persistence, where SARS-CoV-2 RNA or antigens linger in tissues like gut or brain. Defining it is tough due to this diversity. Over 200 symptoms are reported and lack of universal biomarkers, hence making diagnosis and treatment a moving target.
Definitely a kaleidoscope of symptoms defying easy classification. So, long COVID's varied manifestations and competing causes complicate its definition. Could ribavirin, with its antiviral legacy, find a role here?
Potentially, yes. The viral persistence hypothesis persists that low-level SARS-CoV-2 replication or antigenic remnants drive chronic inflammation in long COVID. Ribavirin's broad-spectrum RNA polymerase disruption, effective against viruses like HCV and RSV, could target these reservoirs. Its immunomodulatory effects, reducing IL-6 withdrawal, may also dampen chronic immune activation. Unlike newer antivirals like nirmatrelvir, ribavirin's oral delivery and decades of use despite toxicity makes it a practical candidate for trial, especially in patients with detectable viral RNA or high inflammatory markers, though we need precise patient selection to maximize its impact.
A seasoned warrior poised for a new battle. Ribavirin's antiviral and immune modulating prowess aligns with viral persistence. Let's rewind. How did ribavirin shine in past viral outbreaks and why has its legacy faded all of a sudden?
Ribavirin's track record spans decades of viral crises. In Lassa fever, since the 1970s, IV ribavirin reduced mortality from 55% to 5 to 10% when given within 6 days. per 1986 Lancet trials targeting arenavirus RNA synthesis. During the 1993 hantavirus outbreak in the US, ribavirin cut mortality by 30% in early phase cases, though late stage efficacy waned due to cytokine storm. In SARS in 2003, ribavirin was used empirically in Hong Kong, but retrospective studies showed minimal virologic impact with increased anemia rates clouding its utility. For MERS in 2012, ribavirin interferon combos reduced viral loads by in vitro, but clinical trials stalled due to inconsistent outcomes. Its sidelining stems from toxicity, hemolytic anemia in 15 to 20% cases, sparse randomized data, and also the rise of direct acting antivirals like sofosbuvir, which offers 90% cure rates with 5% side effects.
A valiant fighter overshadowed by newer stars. Ribavirin has battled Lassa, hantavirus, and SARS, but toxicity and competition dimmed its glow. Why did it keep falling short of the spotlight?
Ribavirin's fate owes to three factors. First of all, its toxicity profile that includes hemolytic anemia and teratogenicity, limited broad use, especially in non-emergency settings, unlike remdesivir, nirmatrelvir, hepatotoxicity. Second, its outbreak used lagged robust trials. Lassa data relied on open label studies and SARS or MERS trials were under par with fewer than 100 patients undermining confidence. Third, the antiviral landscape shifted. DAAs like sofosbuvir for HCV or nirmatrelvir for COVID-19 target specific viral enzymes like NS5B or 3CL-Pro, achieving 95% efficacy versus ribavirin's 40 to 50% in HCV combos. Ribavirin's broad mutagenic approach, while versatile, became a blunt tool against precision competitors, relegating it to a last resort role in resource limited or orphan disease context.
A broadsword in an era of scalpels. Therefore, toxicity, weak trial data, and targeted rival eclipsed ribavirin. Back to long COVID. What evidence supports the viral persistence theory fueling ribavirin's potential?
Mounting evidence bolsters viral persistence. 2024 autopsy studies, like those in Nature Microbiology, detected SARS-CoV-2 RNA in 30 to 40% of brain, gut, and lymph node samples 6 to 12 months post-infection, with spike protein in 20% of cases. Biopsies from living long COVID patients showed viral antigens in gut mucosa and monocytes up to 2 years post-acute phase per JAMA 2025. Functional studies link persistence to symptoms. About 20% of the patients with persistent RNA responded to nirmatrelvir, reducing fatigue and brain fog by 30%, as shown per NIH trials. Whether these are replicating viruses or immunogenic fragments, that is unclear. qPCR detects RNA, but culture negative results suggest low ineffectivity. But culture negative results suggest low infectivity. Still, ribavirin's RNA disrupting and IL-6 lowering effects makes it a candidate to test in RNA positive cohorts.
A lingering viral ghost sparking chronic woes. Summarizing persistent SARS-CoV-2 traces in tissues support ribavirin's relevance. How could ribavirin target these reservoirs effectively?
If replicating viral reservoirs drive long COVID, ribavirin's lethal mutagenesis, inducing 10 raised to the power minus 3 mutations per nucleotide, could disrupt low-level SARS-CoV-2 RNA synthesis in sanctuaries like gut or brain, where blood-brain barrier penetration gives it an edge. Its IMPDH inhibition, cutting GTP pool stars RDRP, potentially halting residual replication. Additionally, ribavirin's immunomodulation, down-regulating IL-6 and TNF alpha by about 20 to 25%, as observed in HCV clinical trials, could mitigate chronic inflammation, a hallmark in 30% of long COVID cases. Challenges include dosing, that is, 4 to 12 weeks at 800 to 1200 milligram per day, risks anemia, and identifying RNA positive patients via sensitive assays like ddPCR. Phase 2 trials like those proposed in 2025 viruses editorials are critical to validate efficacy as well as safety in this new context.
A molecular sniper poised to hunt viral remnants. Summarizing, ribavirin's RNA sabotage and immune modulation could tackle long COVID's persistence pending trials. Saakshi, what's the key takeaway about ribavirin's past and potential?
Ribavirin's legacy as a broad-spectrum antiviral, slashing Lassa mortality by 45% and aiding hantavirus, shows its grit despite toxicity with anemia occurring in patients, and weaker trial data sidelining it against DAAs. Its multimodal RNA disruption made it a crisis staple, yet precision antivirals stole its shine. In long COVID, viral persistence evidence, RNA in 30 to 40% of tissues revives ribavirin relevance, leveraging its mutagenesis and IL-6 suppression to target reservoirs. Its future hinges on trials to pinpoint responsive patients, proving this forgotten workhorse can gallop again, blending past lessons with new hope.
Saakshi, you have resurrected Ribavirin's story like a genomicist uncovering a lost variant. Thank you for this illuminating journey.
My pleasure, Anushka. It's been a thrill to reframe ribavirin's saga with you.
Next week on ribavirin's reminiscence and lingering load in long COVID-19, we'll explore real-world long COVID cases where ribavirin or similar antivirals were trialed, decoding their signals. I'm Anushka. Stay skeptical, stay curious.